video is about post-extraction instructions. After a simple tooth extraction, wisdom tooth extraction, bone grafting, dental implants, any dental surgery. The number of instructions remain the same, just slight additions in maybe a dental implant or a bone grafting surgery. So we'll start off with pain. Pain is very normal for the first 2 or 3 days. If you have given an incision on your gum and taken a tooth out, obviously it comes with a little bit of pain, and it usually peaks by the third day. Now, if the pain is quite drastically increased by the fifth, sixth, or the seventh day, then it is very important to go and see your oral surgeon or the person who's done your extraction. So, because it is possible that the tooth area may be getting infected or you may be having a dry socket. Dry socket is when the patient by mistake loses the blood clot, which we want the blood clot to remain inside the tooth extraction socket. This blood clot has all your body's growth factors and it helps in the normal healing of that socket. The way you can lose this blood socket, the blood clot, is if you spit out with force or a lot of rinsing, and this blood clot is quite immature, so with your rinsing it can come out. Or if you smoke or use a straw with that negative pressure, the blood clot can be lost. Bleeding is quite normal, and it is normal for the first 24 hours. Actually, when we put in a gauze after the surgery, and we ask the patient to bite down on it for 45 minutes, in that 45 minutes the blood clot usually forms. So in most cases, there is not much bleeding after you remove that. However, a little bit on and off bleeding is possible for the first day, and especially the saliva gets mixed up with that blood, and it gives a feel as if it is bleeding, but then first 24 hours a little bit of bleeding here and there is quite normal. Some bruising is possible. Usually we see that more after dental implant or bone grafting procedures, and bruising can happen if there is escape of the blood into the tissues, and it can become darker over time and usually goes away by the second week after the surgery. Swelling usually peaks by the third or fourth day, just like pain, and then it gradually starts decreasing after the fourth day. We can apply ice 15 minutes on, 15 minutes off, starting immediately after the procedure, and that helps in reducing swelling quite a bit. The action of ice, it is only there for the first 24 hours, so the initial 24 hours is very critical. You as a patient should use the ice packs that we first give in our dental office, or the ones that you get from your dentist, and after that when you go home you can change that with your own ice packs, the routine ice packs that we have in our fridge, and we can wrap them around a handkerchief and use them on our face. The sutures that we use or the stitches that we use are dissolved. Both types the oral surgeon or your dentist can use. They can be dissolvable or non-dissolvable. The dissolvable stitches usually they can go off or dissolve from starting from the first week anyway up till the third week, and non-dissolvable ones you'll have to go back to your surgeon to get them out, and usually after wisdom tooth extractions it's the seventh day that we remove them. Some surgeons prefer the 10th day, but after bone grafting it's very specific to the procedure that has been done, or with an implant or and bone grafting it's very specific with the procedure that has been done and how many days the sutures or the stitches need to stay in. It can range anywhere between 2 weeks to 6 weeks. So now I'll go over some things that you should not do and then in the end some things that will help you in the healing. uh, no spitting, no brushing in the first 24 hours. Even if you are brushing, then obviously avoid that site of the surgery, and when you're spitting out, open your mouth and let the saliva and the toothpaste fall out on its own. Do not try to spit it out from your mouth. That pressure can get the blood clot out and cause a dry socket. uh, Definitely no smoking for at least 5 days, if possible 7 days. No use of alcohol. Even no, with smoking comes vaping. No use of vaping, and uh, no, do not use a straw. Uh, Eat and drink everything directly from your mouth, and the food has to be cold for the first 24 hours. Do not have anything hot, and after 24 hours switch to warm food, not hot food. Even by mistake, do not apply anything warm on your face in the first 3 days. No use of any ointments on the face which can generate heat. That can cause other issues which we don't want. Things that you can do are apply ice, like I've already told you. Take the medications. I usually prefer giving antibiotics, painkillers like Voltaren, Panadol, and something for the swelling like a serratiopeptidase or dexamethasone. So please take those medications starting 45 minutes after the procedure, once you remove the gauze from your mouth. Usually after 45 minutes, the injection that was given for the procedure is still working, so it's a good time to take your painkillers and antibiotics, so that the painkillers get about 15-20 minutes to start acting before the pain comes in. The food can start immediately from this time, and make sure you have soft or liquid diet. And from the other side, for next 7 days, totally avoid the side of the surgery. That's why we usually avoid doing surgery on opposite sides, because then it doesn't leave any one side for you to eat as a patient. uh, Avoid carbonated beverages, any juices which are citric. These things you should avoid. You can have a lot of yogurt, curd rice, things, ice cream, things which are cold basically. That's about it. Hope you liked this video. Don't forget to comment. Anything that you want to ask as a patient, please put it in the comments below, and I would try to answer it as quickly as possible. I've tried to cover most of the things, but then there may be some things that I've missed out, so I would like to answer them for you. Good luck and have a good healing.